Hi, my name is Alexa, and in August of 2024, I was diagnosed with stage 1B Chromophobe Renal Cell Carcinoma. This has been my second year of marriage. In October of 2022, I got married to my husband. We've been together for 12 years now, and we met in college. So he's been my support system and my rock. I have a very close-knit family as well as my in-laws. We're all very close and spend a lot of time together. I also enjoy spending time with friends, cooking, baking, and exercising. Back in March of 2024, I began having blood in my urine. And when I saw the blood in my urine, I was very scared and worried that something was wrong. So I immediately went to a walk-in clinic, and they had told me that I might have already passed a kidney stone because I was having pain in my lower back on my right side and the blood in my urine, as well as having abdominal cramping, but to me it felt like menstrual cramping. And so they prescribed me with a cocktail of antibiotics, and the blood in my urine never cleared. So after that, I had 2 more trips to the walk-in clinic, more antibiotics, appointments with my primary care provider, and finally, one of the providers that I went to gave me a referral to a urologist. It was very frustrating, especially during this time in my life. My husband and I were getting ready to buy our first house. So we had a lot of exciting things going on. So it definitely wasn't stress-induced symptoms. And, you know, I'm so thankful for that one provider that told me she would give me a referral. She listened to my needs and what symptoms I was having. And then really she, had said, I don't think that this is normal, and I definitely want you to get this checked out. And for me, that made me feel a lot better and a lot less nervous that I was having, second, third, and fourth opinions. Advocacy for me was so important. Prior to my diagnosis and the symptoms, I really didn't advocate for myself in a space in the medical field. I really just said, okay, and just took whatever the doctors told me and didn't really question it. But here, because I was having these symptoms for pretty much 2 months at a time, on and off, I kept pushing and pushing and going to different specialists because I wanted answers. And I'm so thankful for that referral, although it did take me from March to July to get an appointment. I could not get an appointment for months, given the severity of my case, because they kind of ask you all these questions, what color is your urine? Are you in debilitating pain? And the answer was not really. I'm just functioning. But I know I needed an appointment. And I actually got in even quicker because I had a physician's assistant as my first appointment. And she listened to me. She said, you are so young and you are so healthy, and for you to have these problems, we need to check it out. My first appointment that I went to, I had explained to the physician assistant that I did have the blood in my urine and the pain, and I kind of walked her through that timeline. They did test my urine while I was there, and there was no blood. So it was not detected within the eye, but when that test came back to test the urine and do the urinalysis, it did come back that it was present in my urine, and that because I was still having these persistent symptoms, the next step would be just to check it out and do an ultrasound of my abdomen. I really had the ultrasound only a couple days later from my first appointment. It was around the 4th of July, and offices were closed certain days, but this provider rushed the order. And when I went in, I could immediately tell something was wrong because of the ultrasound tech. She was looking and she was very quiet. And she said, okay, your provider will call you back within, 24 to 48 hours. And that was it. So then I knew. I had this gut feeling ever since I went into that appointment that that's what I had, that I did have cancer. When my provider calls, she shares that they did in fact find about a 3.5 centimeter mass on my right kidney, and they could not determine whether or not the tumor was cancerous or not unless other tests were performed. And from there, they ordered a CT scan. The CT scan did not confirm that the tumor was cancerous. And then I had to do a biopsy about a week later. During this time, it was still very hard for me to process the fact that there were no answers. But at the same time, because it took so long for this process to get going, I was thankful that really in a matter of 2 weeks' time, there was a lot of discovery there. I am very lucky that my cancer journey is not as severe as many other patients' journey. I do have to say that the biopsy was the most traumatic part of the whole experience. I was not prepared for what was going to happen, and I didn't know how invasive it was going to be while you're awake. And if I did not have the most amazing nurses in that room, I think that I was going to tell them to stop. They were absolutely incredible, and I will never forget them. After the biopsy, I did have to wait 1 month until I was able to get my diagnosis. And during this time, right after the biopsy, my husband and I said, you know what? Let's take a weekend trip to the beach and to forget about the waiting. And it was the most special trip we ever had. The weather was perfect. We just enjoyed each other's company. We were unplugged. I read a lot of books, and it was so great for me to have that moment with him, because little did we know that a lot was going to change in that next month. My appointment was with my surgeon that, the physician assistant did refer me to this surgeon. And he sat us down for almost 2 hours and had the most incredible conversation. I left there with a weight lifted off my shoulders, saying that I could do this. And even though I did have a diagnosis, I knew I was going to be okay. And the empathy and understanding that my team of doctors had for me got me through this time. I think at first some of those personal questions could be a little intimidating for patients, especially if you feel like you don't fully trust or understand your doctor's methods. However, ask those questions, because in the end, whether they're better than you expected or not, at least you have answers, and you know, with the help of your family, what you can do to move forward. My surgeon presented me with 3 options, and then once giving me the options, I did ask for his opinion. And the first option was getting just the tumor within my kidney removed, but that would leave the kidney with very poor function. And since my tumor was in the immediate center of my kidney, that was not a viable option. And the second treatment would be a radical nephrectomy, which would be to remove the entire kidney, my right kidney, that had the tumor in it. And my surgeon said that the Lord blesses you with 2 kidneys for a reason, and that is true for me. And the third option was to freeze the tumor off. And that would be something that he would recommend for patients that cannot undergo surgery given their age. But with discussions with my husband, with my family, and my surgeon, the radical nephrectomy was the best option. About a month later, I had a radical nephrectomy. And what that is the removal of your whole kidney. And I was lucky that I was able to have a laparoscopic nephrectomy. And so I have 3 incisions on my abdomen. One is directly below my breastbone. The other is right on the top of my belly button. And the third is about the width of my fist across my belly, but if I wear pants, you don't see it. And so I cannot believe already that the scars are minimal. After I had my surgery, I would say about 6 to 8 weeks, I was starting to feel myself again. And for 2 weeks at a time, I had no appetite. And I never experienced anything like this before. I've had surgery in the past, but I never had an abdominal surgery, and that is a whole different game. And once I got my appetite back, then that meant that my strength was coming back. And I was actually up and walking the next day after my surgery when I was released. They want you up and moving to prevent clotting. But for a good 3 to 4 weeks, the only walking I was doing was because I had to, because I was very tired after all that time. And really what I was doing to walk was to aid in my digestion, because your body kind of needs to wake itself up after having a major surgery like that. Once I found out that my surgery was a success and that the cancer did not spread past any of the surgical margins. I was relieved, but it took me quite some time to process. The mental toll that it takes on a cancer patient and the fears that even though you did the surgery or you did the treatment, the pathology doesn't come back for a little bit of time and it's still a waiting game. And it's really hard to accept that and come down from all that weight on your shoulders. But fortunately, I connected with people in my lives that may have gone through similar situations, and just the outpour of support that I had from my closest friends and family to family and friends that I maybe haven't talked to in some time, and even mutual friends that you find out have a similar diagnosis. You form these connections that really I'll never forget. A lot of times when you hear the word cancer, you don't quite know what to expect when you see someone. And a lot of times when I told people about my diagnosis and they saw me for the first time, they knew that I was still that same healthy, bubbly, loud person that I always am. And it doesn't change some of us on the outside. And I also think it's very important to know and bring forth awareness of rare types of cancer for women and men in a young age. Now, the type of kidney cancer I have could be considered a good type of cancer. However, when you speak about it and you want to bring awareness about it, there's no type that's good. And so it's really important for me to be an advocate for renal cell carcinoma because most cases are presented in women over 55, in men over 55, and the majority of it comes out in older men. So to know that this happened to me, but I can make a difference in research and advocacy just means so much. I feel that I have changed tremendously as a person. Prior to my diagnosis, I always wanted to get everything right and get everything perfect and make sure that I was exceeding at everything I do. And I realized that doesn't matter. It's taken me some time to realize and understand how important it is to enjoy life and experiences and not react in certain ways because some things you can't change. And that is something that I've learned so much over this is it's important for everyone to realize how amazing your life is and all the good things that come out of it. Because going into 2025 and this holiday season, I'm beyond grateful for everything. And even my diagnosis, it's taught me to have a lot of mental strength as well as physical strength, and resiliency and really not sweating the small stuff. I would love those who are going through a similar situation as myself to lean on the people closest to you, ask for help, and really just try your hardest to be positive. We all have really good days and really bad days, but there are ways that you can make your good days even better and your bad days suck less.